I thought I'd open this part of the conversation now that you've met everyone and gotten a sense for the diversity of approaches on this panel, which begins to take us from self-tracking as an individual practice into how we're enabling others to track. And add a little context with a quote from a book that I came across a couple weeks ago as it was published, which is called Brain Gain by Mark Prensky. And he observes that we're at this moment in time where we're about to experience a symbiotic, these are his words, integration of technology with our minds, hence the brain gain. And he describes it this way, which I think we've seen evidence of this morning. Humans can now concentrate more, calculate more, analyze more, connect more, communicate more, and create more than ever before. He hopes, or he's observing, that we're on our way to becoming what he calls wiser people, and makes a big point about the emergence of digital wisdom. That's in the subtitle of the book. And he means digital wisdom in a very specific way, pointing back to how first there was stone wisdom, and then there was bronze wisdom, and then humanity evolved steel wisdom, and more recently we evolved atomic wisdom, which we're still trying to evolve. He says that wisdom comes in two forms. It's wisdom arising from and wisdom in the prudent use of each technology. And I think we're at a point in the day and at a point in this market where we're beginning to develop some digital wisdom about the sea of technology around us and the opportunities for self-tracking. Before bringing everybody back up, I wanted to zoom us out in one more way, which is to remind us, this was the bring your own timer. We'll put that aside. Of the world outside the Medicine X context here. So first of all, I thought Susanna's data was earth-shattering, of how many people describe themselves as self-tracking or tracking data. The use of that word was amazing. Second, moments in the life of someone who's spent a career in Silicon Valley and the last 10 days. So I just came from Data Week in San Francisco. And the data people, though we know the digital wisdom on this panel is clear that it's really not the data, it's the rest. The data people are really excited about the fitness app data that's out there. We have millions of users, we have runners, bikers, we have routes, we have geolocation data, we have all of this in a passive fashion in some ways because the tracking attributes of the phone are so celebrated by those communities. Also wanted to give you a piece of data about the quantified self movement, which has been mentioned so many times this morning. It's about 4 years old. Paul and I met in an early QS meetup in that process. I think it started here at Stanford. And now there are now 70 QS meetup groups with great affiliation and membership and over 10,000 people worldwide who consider themselves part of that movement. I consider myself part of it. I'm not a self-tracker. I think we're talking about something that is a very deep and very fascinating aspect of our times. So with that, let me invite back up these three wonderful people. And as they come up, I will point out that all of them are engineers. They're actually pedigreed engineers. We have Stanford, MIT, and Berkeley here. One of them is an MD, who you've gotten to know well this morning, I think. One of them carries one of the most coveted titles in Silicon Valley these days. He's an actual designer. That would be Sean. And then I've been watching, and I think the best way to describe is as a researcher or an engineer turned social activist. As we watch the Quant Coach movement and we watch the data tracking movement emerge, we're seeing Anne quietly but importantly showing up, as far as I'm concerned, in every interesting room in this industry, advancing the cause. So this is about, in my language, kind of coming to market in some sense with self-tracking as a practice. And the first moment in that is what literally happens the first moment a customer, user, I'm kind of an advocate for the word citizen as opposed to patient, but a person encounters self-tracking. And I know, Sean, you've done a lot of design thinking and design work in the community about that first moments in and how this culture and practice unfolds. Would you describe that for us?
Yeah, so for most people that are newbies to self-tracking, which, I mean, the majority of people are right now, they need to see what, like, in the same way that Anne mentioned, like, you don't just give them the tools and then have them know instantly what to do with them. And so having a culture where people, for example, in Chronology, log on to Chronology and they instantly see a bunch of other patients around them that are using these tools and how they're using these tools, right? And so it's that culture that gets more people on board right away.
So literally observing the practice of tracking in others, and also not exactly calling it tracking.
Yeah, exactly. So I think one of the most important things to get people to do this new behavior is for it to not feel like work, right? And so we, as I mentioned in some of those slides, we really try to get people to be health tracking almost accidentally. Like they stumble into it because they're doing some practice that they're otherwise finding benefit from. And then when they look back after a little while and they see that they've logged a lot of data points, they start to see the value. But I mean, if I asked everyone out here, like, are you guys self-quantifiers? And like, basically everyone is, and you just don't know it, right? So like, you're posting on Facebook, right? Like, do you have like any idea like how much like chronological data Facebook has on you, right? Like, you're quantifying your life, and they kind of tricked you into doing it. Like, and I'm happy to do the same thing.
Right.
For the good of humanity.
Yeah, exactly.
like Facebook.
We'll get to business models later. So in the quant coaching process, you're actually all about that first moment. So either Anne or Paul, how does that happen? Describe for us those first hours, days, weeks encounter.
Yeah, and in looking at the stories of people, either before this, just sort of by themselves figuring stuff out, or more recently, sort of as knowingly sort of part of the self-tracking, it seems like in each story there's a moment where the culture of possibility kind of grabs them, where suddenly they say, maybe what I'm doing matters. Maybe if I pay attention, and I can figure stuff out, and that spark gets lit. And I think that I don't know what I could do to have that spark be lit, but when somebody is in that position, what I want the friction between that and being able to get started and get going to be as low as possible. And I think that part of that is more approachable tools, and part of that is having this understanding that this option is available, spread more through the culture, and also having kind of a network of people who kind of know what's going on and ways to find them. And I think that we're very, very early stages of going to that, but I think that even the little start on it we're making is really making a difference, and we encounter lots more people than we can at this point take care of, who say yeah, that's me.
Yeah. Yeah, I mean, I've been getting some people coming to me from the Quantified Self movement saying, I want a doctor who will order labs for me, who will interpret this tome of Excel spreadsheet data. But more than that, now that we've started to have this conversation about how to help people implement this, almost everybody I talk to who has some problem, okay, if I'm doing a sports physical on a healthy kid, that may not, well, even that, but who has some problem, if I ask them, so, what do you think is causing this? What if you change something? And they will, and then sometimes I will actually just tell them that I'm interested in this kind of thing. And I'm getting virtually, like, very high percentages of people who say, yeah, I want that. Or I can see it's a really low-hanging fruit to do some sort of self-tracking experience. And so actually I was worried when we started this little project in my medical practice we wouldn't be able to find anyone. But instead it's actually a little overwhelming. We're having to we're well into a wait list of just people to play with it. We're not even to the point of having it be a formal paradigm yet.
So all of you have mentioned and several times the sharing, culture, process, narrative, all of this non-data, non-technical aspect here. And we had some conversation about, sort of how the earlier conversation about the mind-body medicine approach to pain tracking. I wonder if we could kick that aspect around here of what we're seeing in this place where we're ending up focusing, at least at this early stage in the market, on this place where understanding and in relationship with self and story is playing a big role.
Sure. Yeah. So I mean, I would just first quickly say that people with chronic medical conditions, which is the area that I focus on, come with just two major needs, and one of that is informational, which I tried to hit on, but the other is emotional, right? It's connecting with other people that are going through that same issue that you've had. You've basically had to hide from other people for a long period of time. And you have no one to bounce off to find out what's real. And so I mentioned when I met people at UC Berkeley that also had this condition, I mentioned words like magic and spark, that's what happened. And what I'm talking about there is is emotional validation, right? And if you've ever experienced that feeling, there's nothing like it, and you'll just go back and try to seek to get that same thing again.
Yeah, and I mean, I just can't resist the opportunity to bring this up, but, self-tracking goes back a long time. Probably the Buddha probably was the original self-tracker, and mindfulness meditation is sort of the modern manifestation of that, is just basically watching yourself and paying very close attention to what's happening on a moment-to-moment basis and learning from that. So, and that's really finely honed technology.
Yes.
So what we're talking here is actually very crude external tracking technologies, but it actually is, there's a point to that, I think, because you can, not everybody's ready to go do a 10-day silent retreat or something. So even getting someone to just pay attention and think about what's, feel what's happening to them and record it or report it or share it, gets people into a very different mindset. And I think it is a doorway to have deeper conversations about more mind-body concepts. So,
You wanna?
I would add to that I've really been really impressed at how the process of doing the self-report part of the self-tracking can really itself be therapeutic. So I've seen quite a few instances where it really changes the relationship between the person and the experience. So that instead of the headache or the sleep paralysis or whatever being sort of this meaningless suffering, that it's potentially informative, it's potentially meaningful in that it's kind of another log in the log cabin you're building of possible getting to strategies that work.
So another aspect of our conversation, I think the whole conversation today has been about the role of language in both meeting people where they are and in giving form to the new experience. And so we talked a lot about distinctions between things such as sharing and tracking and experimenting. And experimenting, which comes from a very different place than mindfulness, right, is also part of what we're now able to do. So I'm wondering, for me, even with scientific and engineering training, the thought of experimenting on myself or and now I'm going to do the scientific method on my own, right, is one of those things that just stops me short. And I know, Sean, we talked about how experimenting isn't a word, right, that's kind of in the chronology community quite yet, but you're thinking of going that way. So is this a matter of literacy that's changing? Where are we at here?
Well, so my approach is, I've definitely broken down sort of a lot of the user behavior models behind this, but if you think about it, for someone with a chronic condition that goes through like a series, like a cycle of flares, and they get healthy again, there's certain inflection points where they have motivation to track their health. And especially that's around like they're getting very sick or they're changing an intervention. The interesting like catch-22 there is if you only play into that motivation at that point in time, you actually can't have a very successful experiment because you need baseline data prior to starting that. Right? Mm-hmm. So what we try to do on chronology is actually make it so logging your health is actually something that you feel a need to do throughout the duration. And what we do to motivate that is the fact that every data point that you add is helping other people. So don't just look at it as like a self-centered mindset. It's really every data point that I log will help other people. And then when you do your own treatment experiments, you already have a bunch of baseline data for them.
Yeah, I think language is really important. I mean, if you're talking, you can just talk about this with different words, saying the same thing, and it just says very different things. If I said, what if you were going to pay attention to what's happening for you, tell your story, test your story to see if it's real or if it's some imaginary, thing that you've come up with, and talk in terms of just experience and story and trying new things, as opposed to logging and data gathering and experimenting and N of one and hypotheses. But if I have an engineer in front of me, I'm going to use all those words because it's going to, they'll light right up. Whereas if I have someone who just doesn't think that way, it's really not, it's unfortunate that it's, well, I don't know, it is what it is. It started out from an engineering community, or geeky kind of community, and now it's getting much more broad.
Who, us?
Huh?
Who, us?
Well, I self-identify that way, but yeah.
Yeah. I'd like to add to that yeah. And I think that some of these words get kind of co-opted. And for instance, experimentation, it's like people think that you need a degree in a lab to do it. But in fact, every time we try something different, we start an exercise program or we start eating something new, we're doing an experiment. We're just not very good at paying attention to the results. Because partly I think because we sort of believe that it's not going to make any difference, and partly because I think that we feel disenfranchised from the process of paying attention and thinking it might matter. Whereas I think that we have a real opportunity through this sort of growing culture for people to understand, hey, I can try stuff, I can pay attention to it, and maybe it does make a difference.
Yeah, I think it was Thomas on the first panel was talking about the limiting factor being the attention of the individual, and also taking us into a place of narrowing down or pruning a few variables at a time with kind of an assumption that this will vary over time as your condition and your life might vary over time. So these are early days, but do we have a sense for how, for instance, a community like Chronology and health coaching, quant coaching services and new medical services might actually play out in a single person's life?
Well, yeah, obviously, like it can sound kind of grandiose, but like I do think that if we continue to be, a trusted, valuable resource that is a delight to use for patients with chronic conditions, then, we're the first product that they think of turning to when they're making a health decision, when they're trying to gather information or find a doctor, find a place to get health services rendered. So, there's a chance that what we're building is sort of a software interface for patients accessing the medical system. That's the goal.
Don't be shy.
Well, I'm most of all right now, I'm just trying to see, is this helpful in a medical context, to offer this, to try to figure out what works and what doesn't. But also what's coming up is a lot of ethical questions, a lot of privacy questions, a lot of things about autonomy versus paternalism, and a bunch of different things are coming up. And I think what I'm really interested in doing is sort of fleshing out how this works, what are all the features of it, so that we can then describe it and explain it to others and build it into medical education. I mean, there's any number of ways this could be made ubiquitous, and that's really, I think, if that culture was there, even if not every physician did this one-on-one with patients, if they were aware that it's just another thing you could add, then it would be a marvelous thing.
Yeah, and actually, my primary interest is the effect on specific individuals, especially there's sort of this learned helplessness of, please fix me, and then you're essentially run out of options. What do you do next? Is there an honorable path that you can take that's hopeful and that has a potential to be able to empower you to figure stuff out yourself and to feel less helpless and to feel that there's something you can do, because the helplessness itself, that feeling of helplessness itself, actually contributes, I believe, to a lot of these problems. And that, that just the change in role, even before you've figured out anything, just the change in role of paying attention and maybe it's going to matter, I think can be transformative.
Well said. I think we'll open for questions on that note. And just if you're
Somebody over there.
Somebody.
Yep.
Go.
Hi, thank you. My name is Ataret Hasselkorn. I work for SG2, and my question is mostly directed at Sean. You mentioned the use of your site to almost inadvertently track adverse medical events and side effects, and I'm wondering if the public health loop has ever been fully closed through use of your site or another site, where adverse medical events become apparent, where the data becomes robust, and then the drug manufacturer or the physician or whatever traditional provider organization changes what they're doing to accommodate that.
Yeah, I mean, I think there's a lot of conflicts of interest in the existing healthcare system that prevent important data for patients to get out there and get into the right hands. And I think that there's a pretty big opportunity for a site like ours to actually route the data in the right way to the right people. But it's like early days. Like we spend a lot of time building products and making sure metrics are good over like scrubbing the data at this point.
Thank you.
Hi, my name is Michael Sade. I'm at Cincinnati Children's Hospital. Before I actually ask my question, I do have a response there. There are a couple of apps and programs like Google Flu Trends using these kinds of searches for flu-like symptoms to map epidemics. The whole field of what they're starting to call quantified epidemiology is one such thing, just to throw that out. But my question actually, I'm very intrigued by the notion of this triad of the self-tracker, the doctor, and the quant coach. And I was wondering, how do you scale the quant coach role? What kinds of background or training or experiences do potential quant coaches need? I can imagine that peers could become quant coaches, but how do they do so?
First, you do it in small numbers, and you learn that. We have a lot of thoughts about it. We have some experience now and some data around that, but I'm not yet ready to specify the pedigree of a quant coach. I mean, it might be dependent on the role and the setting and even the individual self-tracker and patient. So I think it's ongoing. Very soon there's going to be sort of an international organization of quant coaches that people where we can start to discuss this on a more peer-to-peer basis of people interested in this phenomenon. And ultimately, maybe there will be training pathways and credentialing, or, I don't even want to go there, though, because I think what we need to do is not get too locked into some diagnosis or, some fixed concept before we begin. And I'm really trying to take a very open-minded, that's why I'm more interested in this medically supervised thing, because my coach that I'm working with, is relatively young. And that's good, because I think she's very smart, but very open to different ways to work with people. And so we're just trying to really explore what works best. But it's going to involve some combination of being smart, having some analytical skills, some sort of coaching skills, and some ability to work with technology and data. So
Let let me at this point ask the demographic question that I think we wish you'd asked earlier. So first of all, how many people in the room considered themselves self-trackers before Susanna's talk? So I think that's a pretty high number. That's pretty interesting.
30%.
Yeah. And how many after her talk, right?
I already asked them the thing about Facebook, so they were probably on the defensive.
Right. So
Exactly.
here's the next one, which is how many people in the room are in a practice or have a role in an institution where you're actually looking at bringing this consumer or citizen practice of tracking into your professional practice? Fewer, but still. So most of us are involved in this phenomenon of scaling, and that was the question. That was going to be my next or closing question. So thank you. Who's next? Is that?
Yeah, I'm curious. There seems to be two models, just from the presentations in terms of how quantified tracking fits in: the medical model, and then the peer-to-peer model. It seems to me that the peer-to-peer model has a lot of advantages, but the inherent disadvantage is that it gets to the word integration. It's not integrated into the traditional source of care, which is the medical practice. And that while exceptional individuals, such as a lot of the folks here, may be able to do self-tracking on their own, there's a good number of people who, 55 plus, who look to the doctor to tell them when something needs to be done. And it seems to me that unless the self-tracking is somehow integrated into the medical practice, and then just like they have care coordinators, quantified coach coordinators, it's just not going to take off. Unless you can seemingly integrate it and then get somebody to pay for it, and then find the time for the doctor during the 6-minute visit to factor in this additional information. Because right now, patients can't even tell their story anyway. They're interrupted within the first 18 seconds they open their mouth.
Well, this is why I started my own practice where I'm not encumbered by anybody else. So I can just do it right.
Yeah, but for all the other people that raise their hand.
Well, you have to do it right first.
Yeah.
Before you can get to these questions of the problems with the insurance system. Like, that's a totally separate issue. If you get encumbered by these barriers, these insurmountable barriers, forget about it. Just stop. Let's just go home.
Yeah. Also, I would
So,
interject from looking
yeah.
at things from the consumer side for a very long time, that consumers are not standing still. And even up through age 55, right? Expecting little, the locus of care is not the physician. The locus of care either doesn't exist or it's becoming my responsibility. And that's the move. And now I'm becoming able to do that because if I could track my runs and my phone knows everywhere I've been and I check in and we're on the cusp of a sea change in my ability to know about myself and execute that responsibility. So I think
Yeah.
Esther's by the mic there.
Okay. This is a sort of general question. We've been talking so much about quantification. Why not quantify the costs and the benefits? It's sort of ironic to be talking about, the problem is we're going to have too many of these coaches and how can we pay for them when we have a huge unemployment problem, number one, and two, all this stuff is actually going to save money if we do it right. And there may well be a McKinsey study that I wish someone would refer us to, but it's something to think about as the business model and, in fact, the social benefits of turning more people into professional caregivers who will many times repay their cost.
Well, I find if I spend 45 minutes with someone letting them tell their story, they consume, and I can't prove this, but they consume radically fewer healthcare resources overall in the subsequent 3 months.
So quantify it.
Well, I don't want to, yeah. But that involves studies and IRBs and this and that. I'm a doer. I'm not a.
Yeah.
Also, I mean, anecdotally, I mean, I've talked to a lot of people who've gone through this experience, and a lot of them, like me, had very, very high medical costs when we were trying desperately to find the answer from the standard medical system that turned out not to exist. And so the cost became a lot less when we started going down this path of figuring it out. And just as one example, I mean, I'd hit the out-of-pocket maximum on the year that I started, before I started self-tracking, and I go to the doctor once a year now, and just for the standard checkup.
Right. And if this is important enough to people, they will do it. And if it's not important, if they don't have a problem, don't see a doctor. Don't do anything if everything is okay.
I'm going to give
So,
Sean a
yeah.
final word, and then
Yeah.
and then we're getting the time to go. I think next session or lunch.
Yeah, well, I mean, on that note, learning from other patients about a diet to help by Crohn's, right? Which theoretically is very minimal cost, kept me from having to switch to Humira, which is a drug that would probably cost me $50K a year or something like that. So it's a diet, right? Yeah, so massive ability to save costs when information flows correctly, right?
Right. But you have to start by just doing it, and the world will catch up. I mean, that's my belief, is that you do what's right, and then the world will catch up. If you worry about the world to start, you're paralyzed, and that's why I stopped working in other settings.
But
So,
I was, as
yeah.
moderator, right, I'm going to take the prerogative to close this with the following. I think Esther's right. We need to quantify our benefits. Let's not argue about that. And if Larry's in the room, can we make next year's Medicine X have a quantify benefits track, approach, project, challenge, something, so we get this going?
And I'm very interested in talking to doctors who are interested in this concept, so I'm easy to find. Yeah.
So thank you all.
Thank you.